Tonight we're putting an old-school home remedy to the test. Senior knees have carried us through decades of steps, squats, and Sunday dances, yet every morning they remind us of the mileage. A simple mix of castor oil and Epsom salt, rubbed into one small spot on the joint, is reported by veteran clinicians to calm that nagging stiffness before sunrise. Sounds almost too easy, right? Stay with me, because by the time this live session wraps up, you'll know the science, the method, and the safety check so you can try it before you head to bed and wake up curious about the difference. I'm a practicing physical medicine clinician who spent 20 years inside rehab gyms and senior centers watching people win back comfort without chasing the next prescription. I'm not here to sell tubs of oil or bags of salt. I'm here to translate research and senior clinic experience into something you can use tonight. Always clear this or any new routine with your own health professional, especially if you have circulation issues, diabetes, or skin sensitivities. First, we'll unpack why aging knees hurt, even when scans look normal. Then we'll dig into castor oil's chemistry, Epsom salt's magnesium boost, and how those two interact on the skin. After that, I'll walk you through the exact blend, temperature, timing, and the sweet spot zone on the joint. We'll finish with adjustments for arthritis, post-surgery scars, restless leg nights, and what to expect across 7 mornings of use. Cartilage thins a fraction of a millimeter each year after midlife, but the bigger culprit is often the capsule, the sleeve of connective tissue that holds fluid around the joint. With age, that sleeve loses elasticity, trapping low-grade inflammatory molecules called cytokines. They sit overnight, pressure builds, and the first step out of bed feels rusty. Anti-inflammatory pills can calm cytokines systemically, yet seniors know the trade-off: stomach, upset, blood pressure bumps, bruising. A topical tool that clears fluid and quiets cytokines where they collect is worth exploring. Pressed from Ricinus communis seeds, castor oil is nearly 90% ricinoleic acid. Laboratory work shows this fatty acid modulates PGE2, a prostaglandin heavily involved in joint pain. It's also a superb skin permeation enhancer, ferrying other compounds through the outer layer without harsh solvents. Older dermatology studies measured castor oil's ability to drive magnesium ions from Epsom salt deeper into superficial tissues, exactly what we need around the knee capsule. More recent imaging with confocal Raman spectroscopy confirms that magnesium concentration in the upper dermis rises within 30 minutes of application when ricinoleic-rich carriers are used. Epsom salt, or magnesium sulfate, dissolves into magnesium and sulfate ions. Magnesium competes with calcium at the neuromuscular junction, relaxing tight muscle fibers in the quadriceps and calf that tug on the knee. Sulfate aids phase 2 liver detox, but when applied topically, its main job is osmotic. It draws excess fluid outward. Combine that draw with castor oil's carrier effect, and you create a micropump, moving stagnant fluid while bathing tissue in magnesium. Recent findings also suggest that magnesium absorbed through the skin doesn't just ease muscular tension. It also supports mitochondrial function, the energy powerhouse of the cell. This may partially explain why some seniors feel an overall improvement in vitality and circulation after a week of consistent use. Improved energy metabolism, combined with reduced inflammation, forms a powerful duo for knee recovery, especially in aging bodies where cellular efficiency naturally declines. A 2020 university pilot study on topical magnesium noted absorption improved nearly 25% when paired with a fatty acid carrier. Senior sports medicine clinics have leveraged that data, reporting quicker morning range of motion gains when patients use the castor Epsom combo versus magnesium creams alone. The oil slows evaporation, giving ions more time to migrate, and its mild warmth, castor oil holds heat, improves capillary flow. Use a glass or ceramic cup. Metal cools too fast. Add 1 heaping teaspoon of fine-grained Epsom salt. Pour 2 tablespoons of slightly warmed castor oil over the crystals. The warmth, no hotter than you'd use for a baby's bottle, helps dissolve the salt just enough to suspend the grains without full saturation. Stir with a wooden stick until you get a sandy paste. If grains remain sharp, rest the cup in a bowl of warm water for 30 seconds and stir again. You want a gentle scrub texture, not a runny brine. If you don't have castor oil at home, you'll find a trusted brand linked in the description. Bend the knee to 90 degrees while seated. Slide 2 fingers from the center of the kneecap toward the inside of the joint until you feel a soft hollow. That's the pes anserine bursa, a common pain generator in seniors, because 3 tendons converge there. This area lies just under the capsule sleeve we mentioned earlier. Mark it mentally. It will be your target. This precise location is particularly sensitive to fluid retention and often goes unnoticed in conventional care. What makes the pes anserine region so crucial is that the convergence of 3 major tendons, sartorius, gracilis, and semitendinosus, creates a focal point for strain, especially during activities like stair climbing, prolonged sitting, or even turning in bed. Inflammation here can mimic deep joint pain or radiate downward into the shin. When treated topically with anti-inflammatory agents like castor oil and magnesium, the relief can be surprisingly fast and localized, providing seniors with noticeable improvement even after the first application. Wash and pat dry the skin, no lotions. Scoop a marble-sized dollop of the paste and press it onto the sweet spot zone, then massage in slow circles the size of a quarter for 3 full minutes. The salt will feel gritty at first, then dissolve as oil warms. Wipe away excess grains, but leave a sheen. Cover loosely with a thin cotton cloth, not plastic. The knee needs to breathe. Optional. Wrap the joint with a soft elastic bandage, just snug enough to hold the cloth. Expect a light, oily film. Clean with warm water, no soap at this stage. Stand, take 3 slow steps, and notice the difference in ease of bending. Many seniors report a 5 to 10 degree improvement in flexion without the usual grabbing sensation. If you feel no change, don't bail. Chemistry sometimes takes 2 or 3 nights to shift fluid dynamics. In fact, part of the healing process relies not only on chemical absorption, but also on improving circulation patterns around the joint. Seniors who accompany this routine with light stretching before bed, such as gentle quad extensions or seated leg lifts, often report faster progress. Movement, even if minimal, promotes lymphatic flow, which helps clear the inflammatory waste that builds up overnight. Pairing the topical blend with mindful movement enhances the chances of waking up with greater flexibility and less stiffness. Each evening, repeat the routine, but after massaging, run your thumb up either side of the kneecap to move fluid toward the lymph channels in the thigh. This manual drainage pairs with the osmotic pull of magnesium, accelerating waste removal. By night 4, the hollow under your fingers often feels less puffy, and the morning walk to the bathroom feels smoother. What many seniors overlook is how dramatically lymphatic flow slows down during prolonged inactivity, especially during sleep. Gentle upward strokes mimic the natural direction of lymphatic drainage, helping to flush away not only fluid, but also metabolic waste that accumulates due to low-grade inflammation. Pairing this with deep diaphragmatic breathing during the massage can enhance parasympathetic activation, which further relaxes tissues and primes the body for deeper healing while you sleep. Some patients even find it helpful to gently flex and extend the knee during the massage, which adds a mechanical pump effect to enhance fluid mobilization. If swelling is pronounced, chill the knee with a cool pack for 10 minutes before applying the paste. Cold constricts superficial vessels, preventing salt sting. Conversely, if stiffness is dominant and swelling minimal, warm a moist towel in the microwave, lay it over the paste for 5 minutes, and enjoy the joint bath effect. Before we get to the safety flags, let's clear up 2 common mistakes that can cancel the benefits altogether. First, overheating the oil. even a minute over gentle warmth, scorches the magnesium, breaking the ionic bond and leaving you with little more than greasy water. Second, scrubbing across the muscle fibers instead of following their length can irritate the tendon sheath and spark more inflammation than it calms. Keep the oil baby bath warm and let your massage strokes glide in the direction the fibers naturally run. Wait until surgical incisions are fully sealed, minimum 6 weeks, cleared by your surgeon. Begin with half-strength paste, which is 1 tablespoon oil and half teaspoon salt, and 90-second massages to avoid irritating sensitive nerve endings. Seniors with knee replacements often find the castor oil softens scar tissue around the implant, improving kneeling comfort. Leg cramps and jumpy nerves love magnesium. Rub the same paste along the calf 1 night a week. Many seniors notice fewer midnight spasms because magnesium competes with excitatory calcium in the muscle, calming the firing threshold. Stop immediately and seek medical review if your knee turns bright red, swells rapidly, within an hour, feels hot to the touch, develops sudden bruising, or if bearing weight becomes impossible. Those are red flags for infection, clot, or structural injury that topical care cannot fix. Otherwise, cease the routine if you see rash itch or excessive redness lasting more than 30 minutes. Castor oil allergies are rare but possible. If you're on blood thinners, press gently. Vigorous massage could raise bruising risk. Diabetics should monitor skin integrity closely and check glucose in the usual manner. Topical magnesium seldom disrupts readings, but diligence matters. One additional consideration for diabetic seniors is the possibility of peripheral neuropathy, nerve damage that may dull pain sensations in the lower legs and feet. This makes it harder to detect mild burns, irritation, or skin breakdown after topical treatments. That's why it's important not only to visually inspect the skin each morning, but also to gently run your fingers over the treated area to check for unexpected tenderness, roughness, or changes in temperature. If you feel anything unusual, pause the routine and consult your provider. Keep a bedside notepad. Each morning, write a quick stiffness score from 0 to 10 and jot whether you could walk to the kitchen without holding furniture. After 7 entries, look for downward trends. Even a 2-point drop on the subjective scale reflects meaningful improvement in daily function. While chat questions flow, I'll address the common ones seniors ask during clinic demos. Can I use Himalayan salt instead? It lacks magnesium, so benefits drop. Can I swap olive oil for castor? It won't carry ions as effectively. Should I shower after? A warm rinse is fine. Soap after 30 minutes. If your notebook shows progress and no skin irritation, keep the nightly ritual for 3 more weeks. Then taper to every other night, or as needed. Many seniors land on a twice-weekly maintenance schedule that holds comfort without daily effort. Hydrate with an extra glass of water the morning after each treatment. Magnesium draws fluid, and you need to replace it. A 5-minute stationary bike, spin upon waking, lubricates the knee, distributing fresh synovial fluid mobilized overnight. Midday, aim for a brief quad stretch while holding a chair, easing tension on the joint. If pain worsens, swelling balloons, or the knee locks, pause the routine and consult your provider. Topical remedies support, but never replace, imaging or targeted therapy when structural damage progresses. We've covered the why, the science, and the nightly ritual. The rest is up to you and your notebook. Mix the oil, touch that sweet spot bursa, and see what tomorrow's first steps feel like. Share your morning notes in the live chat replay so other seniors can compare journeys. And if this simple paste earns its place on your nightstand, let us know. That feedback fuels future sessions where we turn time-tested folk wisdom into practical, evidence-backed action. Take care of those seasoned knees, rest well, and I'll see you at sunrise.